Well, hello, everybody, and welcome to October. Oh my gosh, Oktoberfest and all that good stuff. Um, Basically, what we're looking at is today we're going to be chatting a lot about fractional laser, which we use here in the practice. And Gabby, of course, is our, laser specialist here in the practice. So she's going to be giving us a wonderful tutorial on fractional laser. I'm a big fan. I love it. We're also looking at how does this also incorporate for a little bit of ocular surface disease, especially for our patients of color, because it can be done on pretty much everybody. And Gabby's going to explain that in greater detail. So we are going to let Gabby take it away.
All right, hello. So everyone can hear me okay? All right, so 1540 fractional laser. Two parts of this. Basically, 1540 is the wavelength. 1540 specifically targets water in the skin. When we target for water, basically it kind of vaporizes it and tells the body, hey, there's this micro injury here. Let's go ahead and heal that. And that brings in some collagen and elastin. This collagen and elastin can be helpful for just general fine lines and wrinkles. It can help with scarring, like acne scarring, or even like I had to get stitches and I did one treatment on there and it helped with it a bit. So I've been meaning to do more, but it's a little bit more tender on scar tissue. So you got to take what, you got to have that little push and pull. And fractional laser, meaning that instead of one big laser beam, it's split up into multiple smaller ones to allow for less downtime. Right. So, benefits of fractional laser, again, it does help with anti-aging, acne scars, regular scars, texture, all that good stuff because it targets the water, which pushes for that healing response. So again, as seen with the Icon device that we have with their 1540, it has been shown to reduce wrinkles by 40% with proper pre-treatment as well as with proper, whether that's avoiding using retinol or Accutane or things that can make us photosensitive. With proper pre and post treatment, it is 100% safe and effective. And people even see results in as little as 3 days, which I can definitely vouch for that. I've done 1540 for just for fun, as well as it is really great if you have anything active going on as far as acne, which is my main concern. And I feel like within a day, once that redness goes down, I notice a difference and I feel a little glowy. But it does take 3 to 6 months for collagen production. This can be with any of the Icon treatments, so with IPL 1540, as well as things like microneedling and even like radio frequency, where it does take time to see that long-term result. Alrighty. So again, penetrates deep into the skin to not only target through the epidermis to the dermis where it is having those like wrinkles and where we need to target for anti-aging. We only need a few treatments. So most people, I would say 4 treatments is kind of the average as far as 1540 goes. And again, minimal downtime. The last time I got 1540 done on myself, which I am a sensitive lady, I had 3 passes, which is about average when it comes to having the treatment done. You can have anywhere from 3 to 6. Since I am a sensitive lady, we stuck with 3 and we stuck with lower settings. And I was red for maybe an hour. And then my face just felt weird because it's warm while outside it was cold. And so it was more so it just felt good to be outside and get some fresh air on it. But otherwise, the redness went away pretty quickly. Here is kind of a little video showing what fractional laser looks like going into the skin. So you can see there's little channels where the light goes through. As we treat the skin, we will change where we put it so that we're still getting more than just the channels that are shown there. But basically it just goes through deeper than say other just kind of home treatments and things like that. It's able to reach the area that is required for anti-aging. Here is a before and after of 3 1540 treatments, and you can just see it is a crazy difference when it comes to those finer lines. And that is it. I kept it simple for you guys today because we have a fun little prize.
Yeah, I think one of the things that's lovely about 1540 is Gabby many times takes our patients who are needing IPL and ratchets it up so that we can stack the treatments together, where we can do IPL to get rid of a lot of the brown spots, which also helps reduce our cancer risk, and then go over that afterwards with 1540. And she does this with me. I'm getting it pretty regular, and it's funny because every meeting I've been to recently, and I have no makeup on whatsoever. It's just my sunscreen. That's it, and my moisturizer, of course, and all those things that Gabby tells me to do. But it's been amazing to me how many people have actually commented to me on how my skin just looks so much smoother, and I look more rested. That's what a lot of people tell me. Oh, you look so rested. I'm like, yeah, I get like 6 hours of sleep a night. I could be more rested. But it's amazing. And then your makeup goes on really smoothly when you do glow up. I definitely noticed that too. So it's very impressive. But that's been like every conference I've been to in the last 3 months. And it definitely shows time on the planet, right? And I grew up in Southern California. A lot of you know that. So I've had a lot of sun damage. And so it's been really a slow, nice progression with Gabby, really staying on top of it with me. So I do one probably at least once every 6 months, but if not, maybe quarterly in a way, still to get rid of some of this stuff that I've had from all those years of being at the beach.
And
Yay.
I was having a panic the other day. I looked in my car mirror and like the light was just coming in and I was seeing these lines, which I know it's from me doing that COVID smile where I'd really squint my eyes when I was under a mask so people can tell I was smiling. And I'm the type where on the off season of lasering, because I do go in the sun, and so I just kind of stay away from it during these really sunny times where I am a retinol user. And I'm like, okay, I guess I need to take a break from the retinol and get some treatments in because I saw that and I had a panic because I'm like, I'm doing everything, but I don't bring the retinol super close to my eyes because, I'm a nervous Nelly. But 1540, we get right in there.
It's
Like, I need
it's
to do
very
that.
impressive. Well, and our big issue when I lecture to derms and plastic surgeons, which I do now, exclusively about the eyes, a lot of women are getting Botox in there or fillers, and it's really not safe to do. It can really mess with your blink structure. So we want to be as pure as we possibly can. And so 1540 does a great job of keeping this balanced and also improving the blink. So there's reasons to keep those lids tight on purpose because we blink better. That coats the ocular surface. It reduces a lot of damage to the eye. So there's many more things than just it reducing fine lines and wrinkles. It's just structure function. And I kind of try to talk about that quite a bit because I think people don't realize that that is so important as we get older and lose all that collagen in our face because of those of us who did not wear sunscreen and are paying that price. Yay! um, Amy does fields a lot of questions from patients too coming in, as you know, because Amy's part of our team, and so is Stevie. And Stevie is, we were having a difficult time with her monitor to get her up so you could all see her. So Stevie is there. Stevie, you want to say hi?
Hello.
Unmute?
I do. It takes me a minute to unmute it. But I
All
am
right,
here. I am here, I promise.
good. She's back in the 20th century. We're all in the 21st century right now. So we apologize that her beautiful face isn't up because she always looks great because she's always getting, she's probably better than me on doing her 1540s and she's even doing it on her neck, which I'm like, oh, that looks really interesting. So, but yeah, I think we're open for questions if anybody has some questions today, anything that they're concerned about. I think the big issue here now is we've come through the summer. and we've all had a lot of sun, and it's the fall and winter, which are so great to take care of these things. So we have Terry asking, do you have to undergo the series of 1540 treatments for maintenance? Good question. I'm going to
So
let.
as far as maintenance goes, it depends on, are you just doing 1540, which in that case you do your series, and then every about 6 months you get one treatment. If you've done both IPL and 1540, then it could make sense to, after 6 months, do a 3 for me as your touch up, because then you get a little bit of IPL, a little bit of 1540, double whammy. But no matter what, for most of these treatments, we want every 6 months for not only dry eye, but also for cosmetic benefits to keep up with that. So we don't have to come back in 2 or 3 years and be like, oh, let's do a whole nother series. It's so much easier just to do that little maintenance round, because then, especially if you're like me, where you do like to use retinol and things like that, I just have to avoid it for 4 weeks. And then I have my one treatment, and that's every 6 months of just avoiding it for a month. So I still get to use my favorite skincare, and I don't have to worry about not having any events or sun exposure or things like that for a longer period of time. And so 3 for me is both IPL and 1540. So IPL is done first, and then 1540 is done on top of that. Pretty similar, honestly, when I've had a 3 for me, it is pretty similar to what it feels like afterwards with just a 1540. It's kind of like you don't really notice the IPL that much. It's more so it just feels like you had 1540 done. You will get a little bit of, with IPL, if you had a dark spot or anything, that gets a little bit darker. So that's the one thing that could be different than the 1540. But you still get that slight kind of puffiness and that redder face that you get with 1540 with the 3 for me. And it's called 3 for me because their whole slogan is it takes care of 3 different things, which is red and brown pigmentation. And then it helps with, collagen production, anti-aging, that kind of stuff.
That's my favorite. That's what
Yeah,
I do.
everyone's
That's
favorite.
that's my favorite. That's definitely my favorite. And then just making sure that we're very, very good with that sunscreen and very good with staying on top of the skin, because we know anything around the eyes, we want to be very, very careful what products we're using. And Gabby's really good, and so is Amy and Stevie, about really educating patients about that. As you guys know, when you come into the practice, we ask extensively what you're using around the eyes, what you're doing to take makeup off, because all of that messes with the pH of the tears and the ocular surface. So all this is safe. It's healthy. It's actually your own body healing itself, which is super cool, I think. And it's very effective. It's great. So maybe we're going to have some of these generations that are never going to need much. I mean, Gabby, you started so early doing all the right things. So, man, I wish I
I
had
don't
been
know.
you.
My dad, he used to have tanning competitions with me. So
Ah,
I blame him for any future wrinkles or skin cancer. Because adult me has been good.
there you go.
Yeah.
Well, it pays, and you're doing all the right things for yourself. And what's exciting is the stuff you can reverse. So that is nice to know that we can reduce our risks for skin cancer and all of these things, even looking at plaque formation of the brain. So it's really kind of fascinating. This stuff is, I think we're going to learn more and more as we go. All right. Well, I think it's that time for Stevie to pull a name and see. Stevie, you want to chat about what the prize is?
Yeah, I'm just hitting so many buttons here. I'm surprised I'm still on here. I'm all excited. Okay, so today we're giving away a full phase 1540, and it is by far my most favorite. Well, I pair it with the IPL, so I do the 3 for me. We all know I don't have dry eye. We all know I'm extremely vain, and that's all I do are those treatments. Oh, and radio frequency, anything I can get my hand on. But yes, so I have pulled a name.
Nothing like being honest, I guess.
Yeah, I'm honest. I'm honest. It's just unfortunate you can't see how pretty my face looks. I'm just kidding. That's pushing it. Okay, sorry. So I did pull a name for the full face 1540, and her name is Christy P. So Christy P, you can give me a call and set that appointment up. That would be great. I'm sure you're not excited at all. I know I never am, especially when I win something for free. So yeah, so congratulations, Christy.
Congratulations, Christy.
Yay, we're excited for you. It's so cool. You're really going to enjoy it. All right. Okay, ladies, we're keeping this nice and sweet and short. Next month, tune in the first Tuesday of the month. And we have, what are we all talking about next Tuesday of the month in November? That's going to be the November 5th, right?
I know, I feel like November. That's gonna have to be because I know I have it written down, but I feel like
I
November
should
was a
too.
funky one.
Yeah, we're going to come up with something fun. I think it's all about giving thanks. That's one of our themes for the month. And so we're going to probably try to put something together in that regard. And I think for all of us, we all appreciate all of you, all of our wonderful, fully vision patients and folks that have taken care of things. Yes, thank you. That's election day. Very, very good. Very good, Terry. Thank you for reminding us about that. Yes, so election day is when we're going to be woo-hoo,
Also remember,
here.
ladies, oh, sorry, Dr. Foley, I thought you were, I'm so sorry. Just remember, October is Breast Cancer Awareness Month. Go get your tata squashed.
Yeah, I'm overdue to do that. Yeah. Hey, we're looking at there may be a way to detect breast cancer in the tears. So that may be coming down the pipe. So we don't have to get squashed unless something positive happens. So really cool stuff coming up in development there. Amazing all the stuff you can find out about in the eye about your whole body, isn't it? Super cool. All right, ladies. This is a pleasure as always. We appreciate all of you. Thank you so much for joining us today. And next month, Election Day, we're going to have our election special. Ooh, it'll be interesting to
We'll
see
dress
what that's going to
patriotic.
be. Yes, yes, we'll have our flags waving. All right, everyone. Take good care. Bye-bye.
Bye.